So this video is about the Inspire implant. So this video is the second in the series where you've found you have obstructive sleep apnea and you've found through the endoscopy that you're a candidate for Inspire. And this is again just my experience. I'm not a doctor. I'm just explaining what I've felt like, what's the way things have gone with me. So if you've had the endoscopy and you've qualified for Inspire, I'm just going to explain kind of how it works and then um, go from there. So with the Inspire, there's a cuff that goes and attaches to the nerve under your tongue. And the goal here is to get your tongue out of the way of your airway. So this cuff attaches to your nerve, and during the surgery, they'll test to see which nerve is the one controlling the tongue. So they play around with it and they see which one controls the tongue and does what it's supposed to do. And so they attach this cuff, and then when the cuff is attached, there's a wire that is threaded through your body. It's sort of tunneled through from the nerve down into the chest area. So just above your chest, they'll actually implant the device itself. And so the wire attaches from the cuff to the device, and the device senses certain things with your heart and lungs. I believe it's the heart and lungs, but it senses basically through evaluating what's happening in your heart and lungs, whether you're having an apnea or like an event where you're having a blockage. And when it determines you're having a blockage of your airway, it sends a signal to the cuff, and which sends a signal to the nerve that leads to your tongue, and it tells your tongue to go forward. Mainly the going forward is the main thing it does. And then I feel like because I've started it, the whole process, like I'm actually using it, I feel like it actually pushes your tongue down as well in your mouth. If you're a mouth breather, I breathe through my mouth when I'm sleeping, so it kind of pushes it down, it feels like. And it feels like sort of a tunnel of air. Like you can kind of feel that sort of tunnel where the air is coming through. And so what it does each time you have any kind of event where it feels like you're having a blockage, it moves your tongue forward and manipulates it so that your airway is open. And it works. I just saw some videos with doctors explaining the process, and they say there's still some apneas it works like most of the time, and I think it's pretty good. I haven't really felt like I've had a stoppage where I used to in the past from time to time, and I've felt like I've gotten better sleep. But so basically that's the whole process. Now I'm going to take it from in this video. I'm going to take it from the surgery standpoint. So let's pretend you're getting the surgery and what to expect after the surgery, during and after the surgery, and then I'm going to have another video on the actual process and what happens when it's actually the device is actually turned on. So the surgery itself, they're doing an incision under your um, chin and like right where you see it here. And they do this incision and then they put the cuff in and then they run the wire, they make a tunnel, and the wire runs through a tunnel and then they make another incision. They're pretty big incisions. They're probably, I guess they're about this big each. The chest one's a little bigger, I think. So the chest one's about that big. And they put the implant in, and then they test everything, test the tongue and everything during the surgery. And the surgery is a full-blown surgery, so you go in, you get the gas, you get all the different things, and there's like 10 to 15 people for some reason who are helping you and doing all the different things to get you into the surgery and get you through everything. And so the surgery for me was, um, I had everything done and all that, and then I woke up like almost right away. It felt like it's really weird when you're on that gas. It like puts you out, like you're unconscious. Literally, it feels like you're unconscious, and then you kind of wake up almost. It feels like immediately, and then you're just disoriented and whatever. But when I woke up, they had kind of bandaged it up and everything, and I didn't have any pain whatsoever. I felt fine when I woke up, and I went home, got sick from the anesthesia, and then once that kind of wore off, which that took a while, I didn't really feel any pain. I felt a little like just pain at the incision areas, like the incisions themselves, felt a little bit painful just from being cut. It was like a cut would feel, you know, if you just a couple hours after you cut yourself. But and there was tenderness for sure, like, and it was lumps in both areas. It was kind of a lumpy incision, and so you have that sort of feeling of real tenderness. You just have to be real careful, and you can't do any heavy duty activities. You're not even supposed to lift your arm. They didn't tell me that, but you're not supposed to lift your arm above your shoulder when you have this implant. I had it on the right side, and so I was just careful not to lift my arm. So then basically you're doing wound care for a week. So the first week, the device is not turned on until like the third or fourth week. So the first week you're doing wound care. In my case, they put these like steri strips, and they're these real nice white strips that stay on top of the wound itself and cover up the wound to keep it clean. But I generally change my dressings out every day, so I take off the dressing, set up another dressing. They're kind of expensive, but so I would do that every day, and I would do non-stick dressings. And you have to take a sponge bath for the first week, so you can't get the incisions wet at all, so you can't take a bath or shower. So just be very careful, even in when you're eating or when you're whatever, you know, don't. I love it. People like, you know, have food on their face, whatever, but just anything that gets around it, just don't let anything around it. Keep the bandage over it. Just don't let anything get in that area, or don't be around water for at least a week. I suggest taking off for a week, so you're just relaxed, you take it easy, you're not tempted to do any physical activity, because you can't really strain yourself, you can't lift anything heavy. It'll really upset the surgery. So that's what you do for a week. You just relax. Some people said that you only want to eat from a straw, or you want to eat soup and that kind of stuff. And I didn't find that to be an issue. Eating seemed fine to me, but I got a bunch of soups and stuff. And so I would get some soups and soft food for a couple days, you know, a supply for a couple days, and just do that. And that's what I did, but I didn't really have any issues. The only pain was there was a little bit of pain in my tongue. It felt like it had gone through a workout, but it that kind of went away too. It every once in a while I'd feel that pain come back, though. It was kind of weird, um, but it seems like you can almost, to me, I felt like I could just live a regular life. It didn't really affect me, except for being strenuous, which I usually do strenuous stuff all the time. So I just had to chill out. So that's that first week. And then um, once you have a week or so in, the doctor will have you back. You go to the doctor, and then he takes by that time, it should be pretty dried up, and the wounds should be pretty closed up, as long as you don't have any complications. And then the doctor takes a little thing, and he pulls the steri strips off. And then he looks at it, and he's like, oh, okay, cool. And if there's no infection or anything, they'll tell you all about that. Again, I'm not a doctor. I'm just giving you my experience, so don't take my word for everything. Just listen to what the doctor says. But basically, it closed up beautifully for me. I didn't have any issues. And then the doctor's like, all right, cool, you can go. And that's it. You just takes the strips off, and you get out of there. So then, and they didn't give me any antibiotics, but maybe your doctor might. I don't know. So then after the first week, you have another 2 to 3 weeks of healing. So just take it easy for at least 2 weeks. I would, if you lift or anything like that, or if you do a manual job, I would wait at least 2 weeks. If it's a somewhat strenuous job, I might even wait like 2 months, really. So you wait all that time, 3 weeks or so, and then you have another appointment with your doctor between 3 and 4 weeks, and that's to actually turn on the device. And then so you go back to the doctor, and then the doctor turns on the device, and then I'll cover that in that experience in the next video.